So, I speak to you today not just as a police officer, but as someone who has seen up close the devastating effects of drug abuse on young lives, lives with so much promise, derailed by just one wrong choice and a wrong turn. Drug abuse is exactly that, a chain. It starts with a curiosity, it grows with peer pressure, it tightens with addiction, and often ends in crime. But here's the truth, this chain can be broken, and all of us, especially the youngsters, hold the key. So, why are we talking about the youngsters? Because they are the target and they are also the solution. So, the drug mafia doesn't want strong minds or brave hearts. Many young people fall into this trap, not because they are weak, but because most of them don't see what's coming. That's why we are here to ensure you see it, the youngsters understand it, so that they don't become just another story or number in the police files. This is a chance given to the consumers, only consumers. This is a chance given to consumers to not get into the clutches of prosecution and all, but giving them a chance to reform themselves. There may be occasions when they can be, unknowingly or unintentionally, people might get into the substance abuse. But knowing that, realizing that it is wrong, that they have to seek help, and somebody from the family or somebody from the school or from somebody from the office recognizing that this person needs some kind of help and immediately getting into early intervention is a very effective way of getting people get out of this substance abuse. So, I speak to you today not just as a police officer, but as someone who has seen up close the devastating effects of drug abuse on young lives, lives with so much promise, derailed by just one wrong choice and a wrong turn. The title of today's webinar, which is Breaking the Chain, is really powerful because drug abuse is exactly that, a chain. It starts with a curiosity, it grows with peer pressure, it tightens with addiction, and often ends in crime, broken families, devastated lives, and ultimately a tragedy. But here's the truth, this chain can be broken, and all of us, especially the youngsters, hold the key. So, why are we talking about the youngsters? Because they are the target and they are also the solution. So, the drug mafia doesn't want strong minds or brave hearts. It wants followers or addicts, people it can control. And sadly, many young people fall into this trap, not because they are weak, but because most of them don't see what's coming. That's why we are here to ensure you see it, the youngsters understand it, so that they don't become just another story or number in the police files. What I see in the field is many bright students, many repenting or, grieving parents, doubting teachers, what has gone wrong, and not understanding what is wrong with all of them or what is going on. They feel so helpless, heartbroken, and they have no clue what's going on. And I've seen how young people really lose the vitality in the most, productive years of their lives. Of course, I have also seen young people. I have also heard many stories from Dr. Devika, how they have again taken control, said no, and walked away, and even helped others recover. That's the youth India needs. So let's talk about the legal perspective. So we see that 16 crore are alcohol users. So you must be wondering why we have added alcohol in the drug abuse topic. Because as to the wonder of many, probably the starting point for drug abuse is tobacco and alcohol, which we kind of, normalize a lot in our country. But as a police officer seeing many stories and working closely with Devika Rani, who has been an expert in this aspect, I am completely convinced, and also from my personal observation, that tobacco and alcohol are the starting points of drug consumption. And they're also considered drugs. Now, we see the number of alcohol users, we see how many of those 3.1 CR are cannabis users. The kind of opioid dependency is 2.6% of the individuals who are already into drug abuse. And 18 lakh children need help because most of them are now, they're into inhalants, misusing the prescription drugs. Now, this drug use is alarming not just in urban areas, but the saddest part is that it is extending to the rural areas also, affecting all socioeconomic groups. Now, the reasons why youngsters are particularly at risk is peer pressure and curiosity, mental health issues, mostly out of family situations like single parent or disputes between the parents or lack of attention from the family. There is nobody to share and care in the family. Now, also easy access to substances because of the access through digital medium, whether it is social media or WhatsApp groups. All these are making the availability of substances also easier. And lack of awareness and the fear of being left out when they're in a group, the fear of being left out, or they don't know, they might start using cigarettes or e-cigarettes as a fashion, or just because the other friends are using it. So these are the basic reasons. Now there are several warning signs like behavioral shifts, academic decline, social withdrawal, financial strain, physical indicators, which when we only pay attention to these kind of behavioral, I mean, warning signs, whether it is a family, whether it is siblings, friends, or teachers, those who are closely associated with the person, that they can recognize these warning signs. That is why it is important that we pay attention to what is happening. That is why communication is important. That is why, speaking out, seeking help is important. I'm not touching more upon these psychological aspects because Devika would be dealing more with it. Now, consequences of drug abuse, it has a multifaceted effect for including the physical health deterioration, mental health crisis, the social disintegration. Now, of course, what I deal with is the legal repercussions. Speaking about the legal repercussions, I would say for you to broadly understand, there are traditional crimes, there are white collar crimes. Traditional crimes are those which are affecting a particular individual. Like a theft occurs, it happens to an individual person. A murder occurs, it happens to a person affected. But white collar crimes or socioeconomic crimes are such that they affect the whole society. It has a larger ramifications like smuggling, illicit human trafficking, cheating cases where you see number of people getting affected, and crimes related to drugs. Let me tell you, in the entire, I mean, across the world, after illegal arms trade, illegal trafficking drugs is the second largest crime that happens. And add to it the volume of trade that happens under the, like in the darknet. Now, of course, these are operated through gangs or cartels, which also operate across not just states, they operate across the countries. You must have heard about the Golden Triangle, the Crescent, all these. Now, in India, we have a beautiful act called NDPS Act 1985. I call it a beautiful act because not just it tackles with drug law enforcement, but because this is such an act which has been carefully drafted, systematically drafted, which, when implemented in letter and spirit, it definitely leads to conviction of the offenders in these cases. So it has 83 sections, and it also has a schedule which deals with the list of psychotropic substances which the act deals with. Now, one important feature of this act is that in India, the criminal jurisprudence system holds the accused innocent until proven guilty. But in NDPS Act, the beauty is that, I will say the beauty because it helps in the prosecution and jurisprudence, criminal jurisprudence. The accused is guilty until proven innocent. That the onus is on himself to prove his or her innocence. That should strike to all of you that it is so difficult for an individual to prove his innocence when the whole system has gone according to the act and has put everything on paper from search to arrest on paper as per the act. you should understand that legal complication or difficulty for the individual to prove his innocence. Now, there were some changes brought through amendment to this Act in 88, which has introduced death penalty under Section 31A. So, death penalty where an offender is tried second time after he is already convicted. Now, there is also section introduced called 32A, which means that the sentence awarded as per this act cannot be suspended, remitted, or commuted. You hear that the convicted persons go for an appeal, or they put a representation to the governor or the president of India for suspension of the sentence or remission or commutation, that is decrease in the sentence or decrease in the or complete exoneration from the punishment. So this kind of provision is not available for the sentence that is awarded under this act. Now, there are special courts that are constituted for trying these offences, and these offences are cognizable and non-bailable. The bail provisions under this act are very stringent. And there is also another section that is from this amendment, that is 64A, which provides immunity from prosecution to an addict on condition that if he is willing to go for, some specified number of counseling sessions, then he is given immunity from prosecution. This is a chance given to the consumers, only consumers. This is a chance given to consumers to not get into the clutches of prosecution and all, but giving them a chance to reform themselves. This is a reformative provision that is added through this act. Now, rest all are like the forfeiture of property derived from or used in illicit traffic, and new chemicals or precursor chemicals are also included in the schedule. Now, another change that has been brought in through Amendment 2, I think law is always a dry subject, but I'm just going through all these provisions to let you know that this is the kind of stringent law that we have in the country, and it is advisable for people to know about law because ignorance is not an excuse in our criminal jurisprudence. We can't be aware of this. You have to be aware of the basic, especially the youngsters, when you know what kinds of sources are there to procure drugs, you should know what kind of punishments are there for usage or even possession of such drugs. So now the gradation of punishment depends on the quantity of drug involved, which may have a certain small amount of drug. It is rigorous imprisonment up to 6 months, and the fine is 10,000 or both. As you see on the slide, I'll quickly go through. Quantity, you have punishment is rigorous imprisonment up to 10 years and with a fine of 1 lakh. And the commercial quantity at practice, rigorous imprisonment not less than 10 years and up to 20 years, and with fine not less than 1 lakh and up to 2 lakhs. Now, I'll just quickly cover that, which the Act punishes the production, manufacture, distribution, including warehousing, transport, purchasing, selling, even any owner or occupier knowingly permitting his premises or a means of conveyance for the use of commission of the offense. I had, for the benefit of the youngsters or the benefit of elders, to educate their youngsters that in the following sections we see that even if you finance or harbor an offender or attempt to commit an offense, even an attempt to commit an offense or abetment and criminal conspiracy or preparation. See, there are various stages of commission of an offense, and at every stage, the punishment is the same as for the offense. It is not lesser. It is the same as it is as good as committing the offense. And I would like to give an example for section 27 for section 28 and 29, where there are a group of friends, they go to a party, 4 of them have the drugs, one of them doesn't have the drug, but he knows very well that the rest of the 4 are having. He cannot claim that he is not part of, the group of friends who is consuming drugs. He comes under the criminal conspiracy because he has neither reported, he has neither abstained from going there, he has neither come back after knowing that they have taken, is punishable under abetment and criminal conspiracy. That is why choosing friends and friend circle is very important. I have covered about this death penalty and suspension and remission, cognizable and non-bailable, and the power of entry, search, seizure, and arrest without warrant or authorization. You should understand that the police or any department like central excise, narcotics, customs, revenue intelligence, paramilitary forces, armed forces on like where it is empowered by the central government or any officer of the state government as empowered by it, they have the powers of this entry, search, seizure, and arrest without warrant, and also power of seizure and arrest in public place. So these are all the various sections or provisions that we have in our Narcotic Drugs and Psychotropic Substances Prevention Act. So this NDPS Act, as we call NDPS Act of 1985, this is the comprehensive act which deals with the possession or consumption or transport, all aspects of drug abuse. So after this, I would like to go looking at all this. I or also Vishwa Talks has also started saying that a lot of problems, instead of facing all these, prevention is always better than cure. So prevention is power. Awareness is also the most crucial part of anti-drug abuse campaign. Apart from the police taking up various drives against the cartels, against the gangs, against the supply chains, against the peddlers, an important role that the police also takes part in is spreading awareness about the anti-drug abuse, substance abuse. So all these will have education and awareness campaigns in schools, colleges to inform youngsters, life skills trainings, that is, it is to build life skills, to build the self-esteem, to improve the confidence, to let them enable to say no when somebody is forcing them to take drugs or getting them into drug abuse. Open conversations to not to have any kind of stigma to talk about drug abuse within the family or with friends, or even seeking support from support groups or the NGOs or the police also. And early intervention, yes, there may be occasions when there can be unknowingly or unintentionally people might get into the substance abuse, but knowing that, realizing that it is wrong, that they have to seek help, and somebody from the family or somebody from the school or from somebody from the office recognizing that this person needs some kind of help, and immediately getting into early intervention is a very effective way of getting people get out of this substance abuse. Now, there are various government and community initiatives at the central level. We have the Nasha Mukt Bharat Abhiyan, which is being taken up by at the national level, and various awareness programs and intervention efforts are being taken across India. And in Telangana specifically, the government has established a special organization specializing in narcotics and anti-drug abuse, which is called TGNAB. And they have a toll-free helpline number is 1908, and the TGNAB mobile number is 871-267-1111. So this is a toll-free line. Anybody can call to this. Will be the details will be confidential. They can seek de-addiction support. They can give information about something about drug abuse going on in their neighborhood, in a school, or with respect to any social media campaign that is going on. That also can be tipped off on these numbers. Then peer-led programs. We have several school-based awareness drives, like as Trishant was giving in the introduction. Along with Devika, we have started in Hyderabad, the commissionerate under the leadership of Commissioner Stephen Ravindra sir, school safety clubs and anti-drug committees in the schools and colleges. When we found that the anti-drug committees were also not taken well because of the name, which sounds anti-drug abuse, it doesn't sound well with the schools and managements and the parents. So we converted it into school safety clubs, where we had four verticals: physical safety, digital well-being, anti-drug abuse, and mental health. So if you see, physical safety is related to anti-drug abuse. Digital well-being is also related to anti-drug abuse. Mental health is also related to anti-drug abuse. That is how we have intertwined all these four verticals. Of course, the rest of the three verticals cover even, they have a larger scope. But when we see in the context of anti-drug abuse, we try to, have a overall view of how all these also are either causing or affected by the drug abuse. So how you can help. The very purpose of being here, one of us, is that we can be a catalyst for change, like how as an individual or as a professional or as an organization like Vishwa. So Vishwa talked, we all can change, be a catalyst for change by being a part of the various awareness campaigns. So we have to be informed. All of us should know. We should know so that we don't get to it. We should know that we educate our family members, we educate our neighbors, we educate our colleagues, our friends about the risks and how to speak about it. And we also need to support the friends. When we say peer pressure youngsters into drugs, there are also friends who support these people not to get it. There are good and bad everywhere. So when we should know to whom to keep at a bay, and we should also know whom to talk to, whom to seek support from. Now, also join campaigns. There are several campaigns that are being run physically or online. So please participate in all these campaigns. We are also launching the school safety clubs again in Hyderabad City Police. Also, from this Monday, we're starting with AV College in Domalguda, where the Commissioner of Police also would be probably joining. I still need to take his thing, but Collector will also be joining. Collector of Hyderabad. She's also very keen in joining this drug awareness campaigns. So the school safety clubs will again be launched, which will speak about drug abuse, which will seek the youngsters to come and join, youngsters to help spread the word amongst the community, in the community, in their neighborhood, and among the youngsters also. Now, also say no and help others. So when we have to say no, we need to be confident, we need to be informed, we need to understand that saying no is not rejecting a person, but we are rejecting a choice that would lead us to a wrong direction in our life. Then only when we are informed about the dangers of getting into a certain path do we take healthy choices. That is all from my side. Thank you so much.
Thank you so much, ma'am, for your insights. I'm going to call upon Dr. Devika, ma'am, to take the session forward.
Okay, so I choose the topic as strong mind, safe choices. It's a collective stand, as just now ma'am has ended with this note. A collective stand against substance use. Here we are in this platform. We wanted to empower students, youth, parents, and teachers with the knowledge and action. Why this matters, this topic? Because if you see the global statistics, it's a I think on 26th UNODC have released a report. If you happen to go to it, you can see that there is a 8% increase in the usage, the first time users of this substance use globally. And not only that, post-COVID, you understand the statistics, there is something called new psychoactive substances. We are aware about the traditional drugs. A few of the messages I have been going through. But the world has evolved in such a way where the youngsters, they found the new trends. New psychoactive substances we talk about as designer drugs or synthetic drugs, which are not a traditional drugs, what we are aware, like cocaine, heroin, and all that. I'm not going to name more. But this is a global concern. Not only that, in India is on par with it. Ma'am has showed one slide where about the 2.6% of opioid users is used as a medicinal drug, right? So this is a over-counter drug and the prescription drug abuse, which is a growing concern. India is superseded the statistic. That is very alarming, I would say. And not only that, here I want to say when new psychoactive substances recently, I'm from Hyderabad, so I saw a lot of people from different places in India. We have a student community where the students have learned about how to produce the new synthetic drugs and make edibles. Edibles in sense like eatable or, you can bring. So it is like you morph it or you change the form of that particular drug. And technology is being used in order to spread the information about the availability and accessibility. That is again another concern. So it is quite challenging. Second point, I would say definitely, yeah, understanding these trends, definitely we need to come together in order to prevent because we can save a lot of lives and save a lot of money. If I shared about the few of the cases in future slides, I'm going to talk about how painful it is for the caretakers of the children who are into this substance use. So when we say youth are most at risk and they are vulnerable, I'm also giving the resource UNODC, WHO. You just can go through these sites and then check on these statements so you can understand. So a lot of prevention programs or evidence-based programs we are doing because We don't want to get into the, as ma'am has informed, early intervention, because if we don't do that, we are looking at the damage and the disability, and then we are rehabilitating, and it is a kind of a tiresome thing. And not only that, we need to understand, once a person in this disease called addiction or a chemical dependency or a substance use disorder, what we term or label it right now, the kind of the investment of energy and the therapeutical approach, it cannot help the person to sustain in recovery. There is always, it's a relapse prone disease, as we say. So ma'am has covered about this. I'll also cover in one of the slides about the risk factors why youth are at risk. And next one, I just named few of the drugs, but I would say narcotic drugs, and there are n number of, I would say more than 1,000 varieties of drugs are available in the market right now. But I will categorize them that there are legal drugs and illegal drugs. When we're talking about legal drugs, many questions again I saw in the chat box. Tobacco, alcohol, they are the gateway, what we call gateway of drugs. Once a person starts initiative, there are n number of other substances they can get, use or abuse or addicted or to these kind of substances. My role as a psychologist in a prevention programs, I focus most on how much the drugs have an impact on body and brain, and the vital organ brain, which is very important for any person in their progressive period. So students, especially the children, when we are talking, adolescents when you're talking, and this is we see that age group, the average age is like 10 to 12 years, where we see the cases who are being using the drugs. It means imagine up to 25 years of age, there is a brain still in a developmental stage. And mostly during that phase, our behavior is, the children's or adolescent behavior is operated by the emotional part of the brain or the impulse part of the brain. So when we are talking about the impact on the brain, it means the brain, the next slide talks about what is the cognitive damage it causes. And we all know that the cognitive abilities like learning, decision making, memory, judgment, all these are the important aspects at that point of age. When it impact on this, drugs affect this part of the brain, the cognitive, that's a prefrontal cortex, we call it as. And that is the time they are unable to utilize their full potential of their cognitive abilities. And imagine how much it can impact their life. And forever, we see the children, as ma'am has talked about the consequences, academic decline. When there is no academics and when there is, see, our brain is very important for us to survive, sustain, and then progress well in our life. So when it is, getting affected like this, definitely we see a lot of people losing up their potential to live a healthy life. And when I'm talking about the body part, their immune system, especially the girl population, we see a lot of hormonal disturbances happening because of the drug use. And it's not just that generation. When there is a consistent use of drug use, we also see that has an impact on that. When they become pregnant, during the prenatal they have issues, and after giving birth the child also have the issues. We have seen a lot of children born with the withdrawals when the mother who is pregnant and unable to give up addiction. So and also here I want to say that there is a contributing factor. There is a genetic predisposition. It means the parent, one of the parent is into the addiction, definitely that has higher chances for the child to acquire. Not just this factor, there are a lot of other contributing factors also. That is something which is a very important takeaway point from the slide, that the brain, which is very significant for in a developmental age.